Great. Okay, Sadila, we've started recording. And I want to welcome you to this set of media presentations that we're doing together on issues of race and diversity in clinical supervision. My name is Amelia Lyons, for the sake of the audience, and I'm delighted to welcome Sadila Hussain, who's a senior counsellor in our organisation. And we're here today to talk about issues of race in clinical and diversity in clinical supervision. So what we wanted to also do was to begin by just introducing ourselves and a little bit about ourselves in the context of this conversation before we get into the meat of the issues. So if I can ask you, Sadila, to just sort of share a bit about yourself and your background, as much as you wish to, really, for the video today.
So would that be
a bit about you as a professional, bit about you personally?
Yeah. So I'm Sadila. I'm a counselling psychotherapist by background. I've been working in the NHS for about 5 years now. I've recently trained as a supervisor and an EMDR therapist. And I've been with Aneurin and Bevan for 5 years, and have become a team manager. So my primary goal, well, one of the primary reasons I wanted to get into kind of the counselling field was to be able to support people like myself. I think growing up, I was quite aware that when you'd see health professionals, they would be all from a similar background, and there wouldn't be that understanding. And people quite often come from their frame of reference.
Yeah.
And initially I wanted to work with the young people because I used to work in schools. And having worked in schools and speaking to young girls, especially in schools that were of ethnic minorities, they felt like they didn't see a future for themselves because they hadn't seen women of colour in jobs. And especially like in the school I was working in, there was myself and another woman of colour, and that was it. In a staff of maybe 150, it wasn't a very diverse staff, and they didn't see that actually they could have a job or they could have a career. So for them that seemed quite aspirational. But also I was like, I want there to be that representation. So I think, but also they also would come to myself instead of going to their allocated staff members to talk to, because they were like, you have that understanding, you know what it's like for us. So that was one of the reasons that I wanted to get into the counselling and psychotherapy field, was to be able to support people from the similar backgrounds.
Right, because it's occurring to me as we're speaking that counselling and psychotherapy gives one that sort of privileged opportunity, doesn't it, to have that sort of private conversation with someone, a kind of private and confidential conversation that people have permission. I mean, they may not take that permission, but they have that permission to talk openly. So it does give you a sort of way in this kind of profession, doesn't it, where other professions might not sort of give you the same access.
Yeah, and I think I would kind of identify myself as a British Muslim.
Yes.
And a British Pakistani Muslim.
Right.
So both my parents were born in Pakistan. So I'm first generation. So that comes with its own complexities as well.
Yeah.
So I guess it's being able to have that understanding with certain people that might present in counselling that might be going through similar identity issues around being a first generation. And that doesn't mean that they would have come from a similar background from myself, but they could have come from lots of other different cultures. But some of those identity crises that you have being a first generation child, it's quite hard to straddle two different cultures.
Yes, in a sense, you're forming a bridge, aren't you?
Yeah.
Between, you know, your sort of family, and I mean that in a bigger sense, the family of origin sort of in Pakistan to, you know, and you're the first one, so you're providing that bridge, and so you've got to be in sort of both places and
Yeah.
between.
And I think that can be quite confusing, I think, especially with young people when you're trying to figure out your
Yeah.
identity.
Yeah, is that there's a whole other load of identities going on there as
Yeah.
well, and no doubt you're doing certain negotiations for your parents, and there's all
Yeah.
sorts of things happening, aren't there?
So yeah, there's a lot of layers to it, I
Yeah.
think.
Yes. Yeah, I'm
Um,
recognizing that as we're talking, you know, and thinking about my background, which is that sort of, I think, when you were mentioning earlier, that sort of, I certainly would be perceived, I think, as that sort of, you know, white privileged sort of professional, you know, going into a
mm,
school, you know, and would have been seen in that way. And my own sort of ethnic background is I would describe myself as white Irish. But anyone listening to me or looking at me on the video would think, well, why white Irish? You know, like I haven't got an Irish accent.
mm,
But my parents were Irish, and so they came over to this country, and we all had the choice when we became of passport age. I got my
mm,
first passport at 15
mhm,
of British or Irish, and I
mm.
chose to have an Irish passport. So this is long before Brexit and anything like that. Because you know, we'd gone back to Ireland a lot on holiday,
Yeah.
and you know, and we also, it was 1970s at that point. There was the troubles in Northern
Yeah.
Ireland going on, and there was quite a lot of prejudice against the Irish. You know, if people had Irish
Mhm.
accents, like they'd be looked at as if they were a possible terrorist and all
Yeah.
this sort of stuff. And there was also Irish jokes that sort of,
Mm,
so the butt of the Irish joke is, you know, assumes the Irish are stupid, you know.
mhm,
So I always had this thing that I had to sort of prove that I wasn't stupid, sort of
mm.
thing.
There's a certain
But
undertone to everything.
yeah, 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 yeah. Yeah, and I realize it's incomparable to the, but I wanted to just share a bit about mine, so we both sort of
Mm,
shared a bit about our
mm,
backgrounds in that sense. In a way, I had a sort of slight sense of being on the outside looking in, you know, being sort of identifying with being Irish, and sort of standing outside looking at British
mm,
society. I've never felt totally in it.
mm,
But on the other hand, I can easily present as being part of the establishment, and you know, I am part of the establishment. I don't want to
mm,
deny that as well.
mm,
You know, I
mm,
am part of that
mm,
sort of middle class system, really, that's enjoyed various privileges. So, you know, that's, you know, so we're having this conversation, sort of crossing that bridge and where it goes. I just